Which of the following is considered the most critical step before initiating steam sterilization? A. Drying the load completely. B. Ensuring correct packaging materials are used. C. Verifying biological indicator placement. D. Checking water reservoir levels. Answer: B. The most critical step before steam sterilization is ensuring the correct packaging materials are used to allow proper steam penetration and maintain sterility. A lumen instrument is being prepared for sterilization. Which method is most appropriate to ensure steam penetrates effectively? A. Wrap in single flat sheet. B. Flush with alcohol before sterilization. C. Use a moisture wick or residual water in the lumen. D. Place lumen horizontally. Answer: C. Residual moisture in the lumen assists in steam penetration, ensuring sterilization. Dry lumens can trap air and prevent proper sterilant contact. Which disinfectant is least likely to leave toxic residues on endoscopic instruments? A. Formaldehyde. B. Glutaraldehyde. C. Orthothalaldehyde, OPA. D. Phenolics. Answer: C. OPA is effective and safer for sensitive instruments compared to aldehydes and phenolics, which may leave harmful residues. What is the primary reason biological indicators are preferred over chemical indicators in sterilization? A. Faster result time. B. Lower cost per test. C. Ability to confirm microorganism destruction. D. Easier to interpret visually. Answer: C. Biological indicators directly confirm destruction of highly resistant organisms, giving the most reliable sterility assurance. Which of the following would render an instrument immediately unfit for patient use, even after cleaning? A. Light corrosion on the surface. B. Loose insulation on an electrosurgical instrument. C. Slight discoloration after chemical soak. D. Minor scratches on a retractor. Answer: B. Loose insulation poses a direct safety risk for patient burns or electrocution, making the instrument unusable. When packaging instruments for gas plasma sterilization, which material is best suited? A. Aluminum foil. B. Tyvek. C. Muslin wraps. D. Waxed paper. Answer: B. Tyvek is permeable to plasma but resistant to moisture and microbial penetration, making it the material of choice. During ultrasonic cleaning, cavitation works by A. Scrubbing the instrument with detergent particles. B. Creating microscopic bubbles that implode and dislodge debris. C. Dissolving proteins directly through enzymes. D. Applying high-temperature water jets. Answer: B. Ultrasonic cavitation involves bubbles collapsing to generate energy that removes dirt from instrument surfaces and crevices. Which is the most critical parameter in ethylene oxide sterilization that directly affects microbial kill rate? A. Gas concentration. B. Humidity. C. Temperature. D. Exposure time. Answer: A. The most critical factor in ethylene oxide sterilization is the gas concentration, as it directly determines the microbial kill effectiveness. What is the recommended method to monitor effectiveness of high-level disinfection, HLD? A. Routine microbiological cultures. B. Use of test strips to measure active chemical concentration. C. Checking expiration dates only. D. Visual inspection of instrument clarity. Answer: B. Test strips ensure disinfectant maintains the necessary concentration, as visual checks cannot confirm chemical activity. Why are hinged instruments placed in the open position during sterilization? A. To reduce weight in the tray. B. To prevent warping during the cycle. C. To allow sterilant penetration into box locks and joints. D. To keep them aligned for inspection. Answer: C. Opening hinges ensures sterilant reaches all surfaces, especially box locks and moving parts, preventing microbial survival. In steam sterilization, superheated steam is ineffective because A. It reduces temperature inside the chamber. B. It acts as dry heat, lacking moisture for protein coagulation. C. It damages packaging material. D. It accelerates condensation too quickly. Answer: B. Sterilization requires saturated steam. Superheated steam behaves like dry heat, which is less efficient for killing microorganisms. The Bowie-Dick test is specifically used to detect A. Biological contamination. B. Chemical residue. C. Air leaks and inadequate air removal in pre-vacuum sterilizers. D. Temperature uniformity. Answer: C. The Bowie-Dick test ensures that vacuum-assisted steam sterilizers can properly remove air and allow steam penetration. When inspecting laparoscopic instruments, what defect poses the greatest infection risk? A. Loose screw on the handle. B. Residue within the insulation sheath. C. Slight discoloration of shaft. D. Stiff movement at pivot joint. Answer: B. Residue within insulation sheaths is a hidden contamination source, difficult to detect but highly risky for infection transmission. Which sterilization method leaves toxic residues requiring aeration before safe use? A. Steam under pressure. B. Hydrogen peroxide gas plasma. C. Ethylene oxide gas. D. Dry heat sterilization. Answer: C. Ethylene oxide gas sterilization requires aeration because EO residues are harmful if not eliminated before patient use. The primary role of wicking material in instrument sets is to A. Prevent corrosion during steam cycles. B. Absorb condensation and assist drying. C. Indicate sterility expiration. D. Protect sharp tips. Answer: B. Wicking allows steam to circulate and aids in drying by absorbing excess moisture, preventing recontamination. Which factor has the most significant effect on sterilizer cycle time in hydrogen peroxide systems? A. Chamber volume. B. Load weight. C. Type of packaging. D. Instrument material. Answer: C. Packaging type significantly influences cycle time since materials like Tyvek permit plasma penetration faster than dense wraps. Which part of the instrument is most vulnerable to hidden biofilm formation if not properly cleaned? A. Serrated jaws. B. Box lock areas. C. Handles. D. Shank surface. Answer: B. Box locks have narrow crevices that easily trap organic matter, making them prone to biofilm buildup. Why must enzymatic detergents be used at the correct temperature range? A. To prevent corrosion. B. To avoid denaturing the enzymes and reducing activity. C. To maintain detergent foam stability. D. To reduce evaporation rate. Answer: B. Enzymes are heat sensitive. Excessive heat destroys activity while cold water reduces effectiveness. What is the main reason immediate use steam sterilization, IUSS, is discouraged for routine use? A. It is more expensive than terminal sterilization. B. It does not allow for adequate drying and sterility assurance. C. It leaves toxic residues. D. It requires special instruments. Answer: B. IUSS lacks complete drying and monitoring, increasing the risk of contamination and infection transmission. Which monitoring method provides instant visual assurance that sterilization parameters were met? A. Chemical indicators. B. Biological indicators. C. Load record chart. D. Mechanical timer. Answer A. Chemical indicators change color when exposed to sterilization parameters, offering immediate but not absolute assurance. During decontamination, the correct water temperature should be A. Below 60 degrees Fahrenheit. B. 80 to 110 degrees Fahrenheit, lukewarm. C. 120 to 150 degrees Fahrenheit, hot. D. 180 degrees Fahrenheit and above. Answer B. Lukewarm water prevents coagulation of proteins, making cleaning more effective than hot water, which sets soils. Which sterilization method is best for heat and moisture-sensitive items? A. Steam under pressure. B. Dry heat sterilization. C. Ethylene oxide gas. D. Flash sterilization. Answer C. EO gas sterilization is ideal for items that cannot withstand heat or moisture, ensuring effective sterilization without damage. The integrity of a sterile package is most likely compromised if A. Stored for more than 30 days. B. Stored on a bottom shelf near the floor. C. Exposed to direct sunlight. D. Moved between facilities. Answer B. Storing packages too close to the floor increases contamination risk from dust, spills, and traffic. Which practice minimizes the risk of bioburden fixation during transport to decontamination? A. Keeping instruments dry. B. Covering trays with sterile drapes. C. Using pre-moistened towels or sprays. D. Immediate soaking in hot water. Answer C. Keeping instruments moist prevents blood and debris from drying, making decontamination more effective. Which is the most reliable indicator of sterilization cycle performance? A. Temperature gauge reading. B. Biological indicator results. C. Packaging integrity after sterilization. D. Staff observation logs. Answer B. Biological indicators directly test the sterilization process by confirming microbial destruction. What is the maximum recommended weight for instrument sets to ensure effective sterilization? A. 10 pounds. B. 15 pounds. C. 20 pounds. D. 25 pounds. Answer B. Sets heavier than 15 pounds hinder steam penetration and drying, risking incomplete sterilization. Which instrument damage is most likely caused by improper detergent use? A. Rust pitting. B. Stiff hinges. C. Loose screws. D. Dull cutting edges. Answer A. Incorrect detergent pH can corrode instrument surfaces, causing rust and pitting. The shelf life of a sterile package is primarily determined by A. Date of sterilization. B. Type of packaging and storage conditions. C. Number of instruments inside. D. Type of sterilizer used. Answer B. Shelf life depends on package integrity and environment, not just the sterilization date. Which of the following best describes a clean to dirty workflow? A. Moving sterile trays into decontamination. B. Instruments flowing from decontamination preparation sterilization sterile storage. C. Using separate sinks for clean and dirty rinse cycles. D. Reprocessing single-use items after cleaning. Answer B. Clean to dirty workflow ensures contamination is minimized by directing instruments progressively toward cleanliness and sterility. Which standard provides guidelines for steam sterilization cycles in healthcare facilities? A. OSHA 1910. B. ANSI/AAMIST 79. C. CDC Universal Precautions. D. ISO 13485. Answer B. AAMI-ST 79 is the gold standard for steam sterilization processes, widely followed in sterile processing departments.